Hello, all my dear students, my dear friends. A very, very good evening to all of y'all. And yes, people are asking whether, right, so whether the class has started or not. So, yes, we have begun with the class. And hello, you all. I am Dr.Anaya Kulkarni and I am your guru for the subject of Pedodontics. So, from today, we are going to begin with the live lectures of Pedodontics. And as I always do, I am going to start with one of my most favorite topics, that is child psychology. So, I think I have listeners from final year BDS, there are interns, there are people preparing for NEET, and everybody is here. And I am sure that most of you must be thinking, how can a topic like child psychology be somebody's favorite? But I assure you, attend the lecture, and I am sure you are going to fall in love with this topic. It's a beautiful subject, there's a lot of understanding related to this. And now, when I quote various examples related to different theories, the understanding of the psychology of the children, you are absolutely going to love it. Okay, so I have some more messages pouring on the group. All right, so I hope you are all listening to me now. So today I'm going to begin with the topic child psychology, and I will cover it under various topics like the history, the various important definitions that will be helpful for you to understand the topic, and for those who are in their final year BDS, it is going to be helpful for you for your theory exams, vivas, etc. Also, I'm going to cover the importance of child psychology, the early and late perspectives of psychology, the classification of the various theories of child psychology. We are going to then read in detail about each and every theory of child psychology. All right, so to begin with, why do we read about this topic altogether? So, a better understanding of the psychology of a child, the development of the psychology, basically helps us to understand the child better and to deal with him or her more effectively. See, there are places where you will hear that children are nothing but miniature adults, but it's a complete false statement. Children are not miniature adults. They have a separate morphology, a separate psychology, a separate physiology of their own. And in order to deliver quality treatment, in order to deliver treatment where you are comfortable, the child is comfortable, you need to understand the child better. Okay, they don't come through just like the adults do. All right, and also to detect the deviations from regular patterns of behavior which may interfere with the treatment procedure. See, for adults also, the behavior of the adults, the psyche of the adults is not predictable all the time. So if it's not for the adults, imagine how can you predict a child's behavior? Okay, so for that you read about child psychology, so that you can understand the various deviations in the behavior, the deviations from normal in the behavior of a child, right? That's why this particular topic becomes so important. You're going to further read about endodontics, conservative, operative dentistry in in children. Then we're going to read about space maintainers and extraction and everything. But if you are not able to deal with the psychology, if you're not able to deal with the behavior of a child, you will not be able to perform all these treatments, however good a clinician you are. Okay, so you need to understand how to manage a child's behavior, and for that you need to read about the psychology. All right, so just quickly, I just want to tell you what were the misconceptions earlier, what is the history behind the child psychology. So, the earliest civilization attributed the cause of deviations in behavior to magical or divine forces. Earlier, somebody acting a little different from normal was not considered as a deviation in the behavior or a deviation in psychology. People used to attribute it to certain magical practices. like, there is some ghost inside this particular person, or probably somebody has done some magic on this person, that's why he's behaving absurd. So treatments were basically done by priests. There was no concept of psychologists, there was no concept of understanding the behavior, but the treatment was done by priests. So, Greek and Roman societies applied the medical knowledge to psychiatric symptoms. Okay, then asylums or mental hospitals for the mentally ill were first established in the medieval times, and in the late 1700s, an Australian physician, he practiced mesmerism, which was later modified and renamed as hypnosis. So, what they believed was this particular, difference in psychology or behavior can be only controlled by mesmerism or hypnosis. There was no funda of counseling at all. They did not believe that counseling or a different approach can mend somebody's psychology or behavior. Then in the 20th century, the influence of Sir Sigmund Freud came into play, and Sir Sigmund Freud came to be known as the founder of modern psychiatry. So all the studies, all the basic, the primary studies of psychology were done by Sir Sigmund Freud, and he established the modern psychiatry. Is it clear? Now, why is psychology important? As I told you already, to have a better treatment planning and interaction, modification of behavioral process, to understand the age-specific tasks and behavior, to treat accordingly. So, a person who is a child who is 3-year-old will behave completely differently, and a teenager will behave completely differently. And you have to deal with them in different methods, okay? You cannot apply the same method to both of these age groups. So you need to understand the age-specific tasks and behavior to treat them accordingly. To train different types of children to understand the importance of their oral hygiene practices and to improve them, right? So by definition, so let us come to the first definition. So the first definition that I'm going to tell you is of psychology, okay? So what exactly is psychology? So psychology is a science of human mind and behavior. This was the first accepted definition, which was given by J.B. Watson. So it is a science of human mind and behavior. Is it clear? And this particular definition was given by J.B. Watson. Okay, the second definition that was given by Clifford T. Morgan was again a very accepted definition that said psychology is a science of human and animal behavior. It includes the application of this science to human problems. And this particular definition was given by Clifford T. Morgan. All right. So these were the two widely accepted definitions that came through about the psychology. All right. So then came definitions of child psychology. So basically, child psychology is a science or study of child's mind and how it functions. So what is child psychology? Science of study of child's mind and how it functions. All right, so this is the science of study of child's mind and how it functions. Also a science that deals with the mental power or an interaction between the conscious and subconscious elements in a child. So that's child psychology. Now when we read about child psychology, we are going to read about two things, that is emotion and behavior. So when we read about child psychology, we are going to read about emotion and we are going to read about behavior. All right, so what is basically an emotion? So emotion is an effective state of consciousness in which joy, sorrow, fear, hate, or the likes are expressed. Okay, so this is like an expression. It is an effective state of consciousness. It is an all around state of an organism marked by increased bodily activity and strong feelings directed to some subject. So that's emotion. And basically when we read about emotion, we are going to read about we basically understand two types of emotions. That is the positive emotion. So we know there's a positive emotion and there is a negative emotion. Okay, so when we talk about the positive emotion, pretty clear, it is affection, amusement, joy, curiosity, and happiness. And these positive emotions are essential to normal development. And then when we read about the negative emotions, these are fear, anger, jealousy, and these are harmful to the development. So far so good. Like we read about the definition of psychology, we read about the definition of child psychology. What all are we going to read in child psychology? Emotion and behavior. And the emotion can be a positive emotion or a negative emotion. And now what basically is the importance of emotional development? So the importance, when I'm quickly going to just recite it, I am not going to write it down, just listen carefully, because this is more of a more it will be helpful for the theory writing part and not for the MCQ part, but just listen it out. So the importance of emotional development is it helps in better understanding the child, to understand the problem of the psychological origin, to deliver a dental treatment service in a meaningful manner. Okay, meaningful manner as in you are being empathetic, you are being a good listener, you are not torturing the child, okay, in order to deliver the treatment. So you are delivering it in a meaningful manner. Also, to establish effective communication. Why is it important to establish effective communication with the child and deliver the dental treatment in a meaningful manner? Because your treatment will form an attitude in the child's mind. If if you're torturing the child, like for example you have to pull out a mobile tooth and the child is extremely scared, though you are persistently telling him it's just a matter of 3 seconds, the tooth is moving, it's going to come out in no time, but the child is very very scared. So what you do, you make 3 people hold his hands and legs, and then the child is crying and he's yelling, but you still forcefully just pull out or give LA and pull out the tooth. So your work is done, but you have instilled a negative attitude in the child's mind. The child is going to be so scared in going to the dentist, or forget coming back to you, he's going to be scared in going to any dentist for that matter next time he has a dental problem. So your goal as a pedodontist is difficult, because your goal is not just to deliver the treatment or get the treatment done. Your goal is basically to deliver a meaningful treatment and establish an effective healthy communication, so that he's not scared to come back to you for the next time. Right. The another importance of reading about psychological or emotional development is better teaching of the primary and preventive care. You can do that effectively. Effective treatment planning and execution can be done, and you provide a comfortable environment to the patient. So these are all the importance. Now when we read theoretically, like by the books, when we read about emotion, we read about these following emotions on which you get questions, that is MCQs as well as theory based questions. So we are going to read about cry, we are going to read about so we are going to read about anger, we are going to read about fear, and we are going to read about anxiety. Am I clear? So we are going to read in detail about these 4 emotions. So these 4 emotions, because they adversely affect the child's behavior. If a good emotion is positively affecting the behavior, we don't need to worry about it. The child is healthy, happy, he's ready to get the treatment done. So that's not a problem for us. But these negative emotions affect the behavior adversely, and that's why we need to read in detail about them, because we need to manage them. That's why. Alright, so let's first take up the topic cry. Okay, so these are small topics. So first let's take up cry. Let me take a beautiful color of the pen. Alright, I'll take blue. Right, so cry. Yeah. So when we read about cry, Ellsback in 1963 gave 4 different types of cry. So who gave it? Ellsback. In 1953. He gave 4 different types of cry, and these 4 different types of cry were, so there are 4 different types of cry. First is obstinate cry. The second is frightened cry. The third type of cry is hurt cry. Okay, the hurt is looking like hurt, right? I'm going to write it in a better handwriting. Alright, so hurt cry. And the fourth type of cry is compensatory cry. So there are a lot of chances that you will get MCQs related to this small topic, that is classification of cry, and you might get short note answers and everything related to this topic. So what exactly is obstinate cry? Okay, so I think I have a picture for you for every cry. These are painful pictures. All right, so this fellow, what he is doing is an obstinate cry. All right, so what's an obstinate cry? The child throws a temper tantrum throughout the dental treatment. So the first feature of an obstinate cry is temper tantrum. My God, look at the way he's crying. Alright, so the child throws temper tantrum. Now what is temper tantrum? Temper tantrum means he is angry. Okay, he has yet not, he is not yet sitting on the dental chair. You have just, he's sitting on the waiting sofa with his parents, and probably because he has already started crying, you have examined the child on the waiting sofa only. Yes, you have to do that sometimes. And now that you've told him ki you will have to do a small little filling, and I'll just check you when you come and sit on my dental chair, and now he's throwing temper tantrums. That means he's angry. He does not want to sit on your dental chair, and he's stubborn. He's just fixed to the fact that I am not going to sit on that dental chair. And temper tantrums means he's stomping his hands and feet. You throw your hands and feet like that. No, children, not you. Children do that. They'll stomp their feet, or they'll throw their hands in air, and then they start crying out of stubbornness. That's called as throwing temper tantrums. Temper means anger. Okay. Such type of a cry is loud. It is high pitched. Okay, it is going to be a shrill, bad cry that you can see from the picture only. I'm sure you are able to hear this picture. Then it will be repeated all over again. Okay, it is repetitive or repeated again and again. All right. So he will be very angry, he will be stubborn, he will be hell bent that I don't want to go inside and sit on that chair. So he'll just give out a loud, high pitched cry. He will stop for some time only, and then he'll start crying again. Okay, so that's repetitive, it's high pitched, loud, and it is characterized by throwing of temper tantrums. And one very important feature of an obstinate cry that generally appears in MCQs is that it is characterized by a siren-like wail. Okay, so it is called as a siren-like Wail. Okay, so what is wail? Wail means a cry. Okay, that's a wail. So it is characterized by a siren like wail, and it is generally a child's external response to pure anxiety. He's not hurt, he's not in pain, it's just anxiety because of which he's letting out that cry, and it is characterized by siren like wail. So what question you might get is as an MCQ is, which type of cry is characterized by a siren like wail? So very confidently look for obstinate cry and mark it right there. Again, if you get terms like temper tantrums, you know it's an obstinate cry. So obstinate cry, temper tantrum, siren like wail. For the MCQ people, that these three things you should know that they are interrelated. So that's an obstinate cry. Okay, am I clear? The next type of cry is a frightened cry. Okay, so this is a frightened cry. So what are the features of a frightened cry? So the features of a frightened cry are, alright, so it is usually accompanied by a torrent of tears. So what is a torrent of tears? Torrent means, okay, torrent of tears. So torrent means a flood of tears. So it is accompanied by a flood of tears, a torrent of tears. Okay, it is also characterized by convulsive breath catching sobs. Okay, so generally I act it out. So it's like that the child will cry, right? So that's called as breath catching sobs. Okay, so torrent of tears, breath catching sobs. Okay, and then it usually the child emitting this type of cry has been overwhelmed by the situation. He's actually very scared. Okay, he's not throwing a temper tantrum, he's very scared. You just have to, you know, for such a child you can so this is basically overwhelmed by situation, overwhelmed by situation. And when we read about the obstinate cry, it was basically response to anxiety. Can you see it? Yeah. Okay, so every type of a cry has a reason also. Okay, so obstinate cry is response to anxiety. Frightened cry is when the child is overwhelmed by the situation, is really scared, is thinking of, you know, big knives and needles and everything. Okay, so he's the child is frightened and overwhelmed. That's why such type of cry, characterized by torrent of tears and convulsive breath catching sobs. Right. So the next type of cry is a hurt cry. So that's a hurt cry. Okay, he looks very hurt, right? So basically, yeah. So hurt cry may be loud and more frequent. So it may be loud and more frequent. Okay, it is frequently accompanied by a small whimper. Okay, it is loud, the hurt cry is loud and more frequent. So the picture says it all. Okay, and whimper is like small episodes of sobbing. Okay, so or small, you know, voice that comes out with the cry of a child. Okay, so initially a child in discomfort in such a discomfort, the hurt cry will show a single tear filling the corner of the eye, running down the child's cheek without making any sound or resistance to the treatment procedure. Now I'll tell you a situation. So for example, say a child you is sitting there for a filling. You started drilling the tooth, and when you started drilling the tooth, what happened? You are nearing the pulp and you accidentally expose a small pinpoint pulp, and the child has pain. So what will he do? He'll just give out a very loud cry. He will be hurt. He will be, you know, he will ask you to just remove your hand. He'll get out of the dental chair. Probably he'll sit on the dental chair and he'll start crying exactly like this. Right? So that's the hurt cry. Okay, it will be loud, it will be frequent, accompanied by a small whimper, because there will be that painful voice in that particular cry, characterized by a single tear rolling down the cheeks, and then it is accompanied by a flood of tears. So that is actually associated with pain. Okay, so that's the reason of this particular type of cry. Then we come to the next cry. Okay, so the next cry, there is no picture, I'll tell you why. So the next cry is the compensatory cry. Compensatory cry. So there is no picture of a compensatory cry because a compensatory cry is not a cry at all. So the biggest feature of a compensatory cry is it is not a cry at all. So basically it is a sound that a child makes to drown out the noise. For example, a drill, like for example you are doing a filling which is non-painful, but the child is scared of the voice of your erotor, so he'll keep making that noise, like that noise he'll keep making. Okay, so that is keeping him distracted, and that is distracting him from the noise, the scary noise of your erotor. So that's called as the compensatory cry. He's trying to compensate the scary sound of your drill or the erotor. So usually this cry is slow. It is a monotone. That means there is no rise in the voice or fall in the voice, nothing. It's a monotone. It just goes on like that only, in the same frequency and everything. Okay, so that's a monotone. It is sort of a coping mechanism to unpleasant auditory stimuli. So what is it? It is like a coping mechanism. It is a coping mechanism to unpleasant auditory stimuli when the child finds himself in an uncomfortable situation. So that's the compensatory cry. So I hope now you have understood the meaning of all these cries. I want you all to know the typical characteristic of this cry, the type of sound that is made out, okay, and the type of activity it is associated with, and also what is the reason behind that particular type of cry. I want you all to know. So you will get MCQs based on those particular things. Okay, so just excuse me for a second. All right. So that is what we had to read about in the topic cry. Now let us jump to the next emotion, which is anger. All right. So anger, what is anger? It is the outburst of the emotion. It is an outburst of the emotion caused by child's lack of skill in handling the situation. Alright, so what is anger? Anger is basically the outburst of emotion when a child cannot handle a particular situation, okay? He'll get angry. So, infant and young children respond in anger in a direct and primitive manner, but as they develop, the responses become violent and more symbolic. Okay, so a younger child will do it in a more direct manner, like he'll tell you, okay, that I am not happy with you, I am angry. Okay, but as the child develops or as the child grows older, the responses will become more violent, more indirect, and difficult to decipher. All right. So, just to tell you the various responses of anger in various age groups, a 15-month-old child, he will do what? He will throw objects. Okay, so a 15-month-old child will throw objects in order to express the anger. A 2-year-old child, he will attack the other children with an intention to hurt. Okay, 2-year-old child will do that when he is angry. A 4-year-old will express their anger through, asking for something or begging for it. Okay. Then a 5-year-old will express less anger otherwise. And by the time the child is 6-year-old, he will have more violent modes or more violent methods of expression of anger. All right. So eventually, as the child grows older, so the 7-year-old will display less aggressiveness through kicking or throwing objects. 8 to 9-year-old will the 8 is expressed through feelings and becomes a more direct expression. By the time a child is a teenager, he might take out his anger on someone else. So that is how a child of various ages reacts in case of anger. So that was about anger. Let us now come to fear. Okay. Okay, so what is fear? Fear is the unpleasant emotional state consisting of psychological and psychophysiological responses to a real external threat or danger, including agitation, alertness, tension and mobilization of the alarmed reaction. So that particular definition was given by Dorland Medical Dictionary, and it is also defined as a painful feeling of impending danger, evil or trouble. Again, there was a very nice definition, short and sweet, given by Rubin, which said that it is defined as a reaction to a known danger. So what is fear? Fear is a reaction to a known danger. Is it clear? Now there are different types of fears corresponding to age. Okay, so what are the different types of fears? All right. Okay. So the different types of fears, I'll just quote some examples. Like for example, if a child is 0 to 2 years of age, so he will be scared of strangers, loud noises. Just imagine a child who is 0 to 2 years of age. So he will be scared of, let us write this down. So 0 0 to 2 years, the child will be scared of strangers. He will be scared of loud noises. Then he will be scared of loss of support. And then strange objects as well, like strangers or strange objects, he'll be scared of all these things. Like for example, for a 0 to 2-year-old child, stranger to is scary only. He'll go in somebody will take him and then he'll start crying. Strange objects also he's scared of. Like for example, if you buy him a cute dinosaur, like for example, if you just press a button and then the dinosaur is going quack quack or some strange noise, it'll there will be there in the dinosaur, the child will instantly get scared because that object is strange. So a child is not only scared of strangers, he's scared of strange objects also. I remember one of my patients, he used to be scared of anything that is furry. Like, he used to hate soft toys, like anything furry. Even when I used to take cotton in my hand, if there is a big blob of cotton in my hand, he used to be scared of that cotton. He did not like anything very squeezy and furry somehow. Okay, so he used to be scared of these objects. So there are various other things that these children are scared of. Now when a child is 2 to 4 years old, he will be scared of being left alone. Okay, there is a term called as separation anxiety. So the child is going to be scared that he will be separated from his parent or guardian, whoever has come with her or him. Okay, so there is a fear of being left alone. Then again, there is fear of darkness, and there is fear of animals. Okay. Right. Then a child who is 4 to 7 years old will be scared of environmental threat. Okay. So environmental threat will also include ghosts. Okay, like for example, there is a tree moving in the dark, or the door is open or the window is open. So all of these things, these are environmental threats. And imaginary creatures and animals, like I told you. So imaginary creatures. So okay, so these are the children where you can tell them that, okay, that Babaji is going to come and pick you up. That's a person who catches children, or you can scare him of ki that uncle is going to come and hold you now if you don't sit properly. So these people are scared of imaginary creatures, various environmental threats and everything. Okay, then an 8 to 10-year-old is scared of animals, burglars, or thieves, or people who murder, people who kidnap. There are all sorts of imaginary things. And personal harm. Okay. And then finally, an 11 to 13-year-old, so around 13 to 14 years of age, that's the limit of pedo people. Okay, the pedodontists, we do not look at people more than 13 years of age. All right, so 11 to 13, they'll be scared of animals. And again, being around strangers or being separated from parents, yes, that particular age, they will be scared of that. Like separation from parents. So there are parents who will tell that I'm going to send you to boarding school and stuff like that, so they'll get scared of it. Okay, so these are basically the various things that different types of fears of different types of ages. Okay, so now when we read the actual classification of fear, what are the types of fear? So this is a classic question for theory, as well as you get a lot of questions related to types of fear in the MCQs. So when we read about the types of fear, so there are 3 types of fear and those are innate fear, then there is objective fear, and there is a subjective fear. Okay, so let me tell you like this, so it will be easier for me to explain like that. So there is innate fear, there is subjective fear, and then there is an objective fear. Right, so there are these 3 types of fears that are present. So what exactly is innate fear? So innate fear is nothing but a type of fear that is present in a particular person from birth. So by the term innate, you can relate the term inbuilt. So this type of fear is inbuilt, and that's why it is called as innate. So that is an inbuilt fear or present from birth. Inbuilt fear and present from birth. Okay, so that is innate fear. For example, let me tell you, there is no previous experience or stimulus related to such a fear. Okay, like for example, a small child, if you leave him in the darkness, he will start crying, he will be scared of the darkness or being separated. Nobody has taught him, neither does he have a bad experience being left alone in darkness or anything, but he's going to be scared. So why? Because the fear of darkness or fear of being left alone is inbuilt. Nobody needs to teach it, so that becomes a innate fear. Okay, so the characteristic again is there is no previous experience, there is no stimuli, and so this is inbuilt fear. For example, the fear of darkness. Then comes the subjective fear. So by the term subjective, I always relate the term suggested. So it is a type of fear that is suggested by others. Okay, like for example, there is a small house. Okay, so you somebody tells you that there is nobody in the house, you can just go and see how the house is. Okay, so you will go inside, you will see, okay, walls, windows, doors and everything, and you're going to come out. But in case somebody tells you that this house has been left, nobody has stayed in this house for the last 10 years because somebody told that there is a ghost inside, and when you go inside you'll get locked inside, or probably somebody is going to come jumping on you or something like that. If somebody says that, you are going to be, or especially a child, at least you to still have good developed brains, but even then you will be scared. I will to be scared, but a child will get extremely scared. He won't go inside only, and even if you force him to go inside, he is going to imagine things pouncing on him. So he has not had a previous experience, but because of somebody else's suggestion, the fear has developed. Okay, so there is no previous experience associated with this, but due to the suggestion of others, the fear has developed. So that becomes a subjective fear. Like for example, there are parents who have the habit of saying, don't eat so much chocolate. If because of eating the chocolate you have pain in your tooth, I'm going to take you to the dentist and he'll give you a nice injection and he'll pull out your tooth. So now what you have told the child, what you have fed into the brain, that the only job of a dentist is to give injection and pull out the tooth. So now you've suggested that he is like that only. So next time when the child has a tooth pain, he's already going to be scared. He has no previous experience, but he will be scared that that dentist fellow is going to hurt me. So that's a subjective fear. Is it clear? And then we have the objective fear. So objective fear is the one that for which a person has a experience. When the person experiences this particular thing, there is a previous experience and a stimuli involved, so that is an objective fear. Like for example, if there is a dog, okay, so if there is a very small child who does not know what a dog is, what a dog can do, so if the child goes near the dog in a very friendly gesture, but the dog is not a very good dog and he suddenly barks, okay, so the child gets scared. So next time he is going to be scared of every dog. So because he has experienced. Like for example, I'll tell you one more example. Yeah, so there is a very hot object. Like for example, there is hot milk and there is the utensil of the milk. You are telling a child, don't touch it, it is very hot. But the child is very naughty, he'll still go and touch it, and then he'll burn his hand, and after that he is not going to touch even a cold object with full confidence. So that because he has developed a previous experience. So whenever there is a bad previous experience involved, that is an objective fear. When a particular type of fear is suggested by the others, it is subjective fear. And a type of fear which is involved by nobody suggesting it, no previous experience, it is inbuilt, so it becomes an innate fear. So I hope the type of fear is clear to you. So we are now done with the topic fear. Right? Let us now come to the last emotion, I think. So what all emotions we were about to read? Where are the emotions? Yeah. Here are the emotions. So we are done with cry, we are done with anger, fear, and now let us come to the last emotion, which is the anxiety. All right. So what is anxiety? Okay, so anxiety is often defined as the state of unpleasant feeling combined with an associated feeling of impending doom or danger from within rather than from without. Okay, so let me just write it down for you. So it is defined as a state of unpleasant feeling combined with an associated feeling of impending doom or danger from within. Okay, so just to be very clear, see, fear and anxiety sometimes we feel are used synonymously. Okay, so both means you are scared, but there is a very fine difference between fear and anxiety. So fear is basically being scared to a, what did I tell you in the definition over there? So it is a reaction, yeah. So fear is basically a reaction to a known danger, whereas anxiety is a reaction to an unknown danger. Okay, so this is what it is, a reaction to unknown danger. Am I clear? All right. So that's a reaction to an unknown danger. Okay, so for example, you know what is fear now. Okay, you are scared of dogs, you see a dog, so what you will feel is fear. If there is a huge dog coming towards you, what you feel is fear. That's not anxiety, that's fear only. You're scared of dogs. But for example, you are standing in the queue for Viva and you are roll number 3, and roll number 1 walks out of the Viva room and he says that, oh my god, this is the worst external examiner ever. He is going to drill you, he's going to roast you. So while you are roll number 3 and you're waiting in the queue for your own Viva, what you feel is anxiety because you are not sure what is going to happen inside. So that's a reaction to an unknown danger. Or for if you have to perform on the stage, you have to go for a debate or a speech competition, so what you feel is anxiety. That is you, that's a reaction to an unknown danger. You always anticipate the worst, right? That the mic is going to fall down off my hands, or I'll blurt something stupid and everybody is going to laugh at me. So that's all unknown danger. So what you feel is anxiety. All right, again there are two types of anxiety. So the anxiety can be a trait anxiety, or it can be a situational or state anxiety. Okay, so these are two types of the anxiety. So what is basically trait anxiety? It is a lifelong pattern of anxiety as a temperament feature. These children are generally jittery, skittish, and hypersensitive to stimuli. Okay, so trait anxiety, that means it is inside you. It is like nicely tattooed inside you. Okay, so that's your trait only, that's your character. Okay, so such children who are like that, you say no, that child is very anxious all the time. Like, you know, he'll get startled very easily, or he generally looks very careful or jittery or, you know, hypersensitive. So that's trait anxiety. Again, there is a state anxiety or situational anxiety which occurs only in specific situations. Okay, I hope it is clear. Okay, like for example, trait anxiety, the person is always anxious. And situational anxiety, like for example a person has had a breakup, or for example if he's going to give a speech for the first time, or he has lost a lot of money, or there are chances that he will lose a lot of money, he's bought something or something like that, and then he thinks that it was not a good decision, so he is anxious at that time, so he is reacting only in a specific situation, so that's state anxiety. And if okay yeah and if somebody is always anxious, it is trait anxiety. Clear? So an important aspect of treating the child patient, which is different from treating adults, is in the intimate involvement of the parents in the relationship, which completes something that is called as a pedodontic triangle. So now what happens, you are a dentist, you have read about child psychology and behavior management very very thoroughly, and now you think you are the king of child psychology management and everything. But no, your treatment will not be successful, or your rapport with the child will not establish until you have the involvement of the parent in and out in that particular situation. So hence, because of, and then three of you all, you parent and child, you hand in hand will give result to a healthy dental treatment and inculcating a healthy dental attitude. So that is why this phenomenon called as a pediatric triangle or a pedodontic triangle was given. Alright, so we have a pedodontic triangle. So what is a pedodontic triangle? So there is a triangle like that, and you will always get a question, where is the child located in the pedodontic triangle? So the child is always located at the apex of the pedodontic triangle. So this is the apex of the pedodontic triangle, and the child sits over there. And then there is parents or the family, and then there is the dentist. And when you make a pedodontic triangle in your exam, for example, so you must never miss these arrows. These arrows that are going everywhere, here and here and here, everywhere, show that each component of the triangle is interdependent. The child is dependent on the behavior of the parent and the behavior of the dentist. The dentist is dependent on the behavior of the child and the parent, and again the parent is dependent on the behavior of both the child and the dentist. Okay. So this pedodontic triangle was given by Gerald Wright in 1975. Okay. So I am missing a red color. Let me take a good red color. Red. Alright. So this was given by Gerald Wright in 1975. Okay. So this was given by him. Now, eventually in 2004, McDonald gave a revised pedodontic triangle where he said that not just the parent, child and the dentist, but the society also plays a very, very important role. So, these components remain the same: the child, the parent and the dentist, and also the arrows remained the same, but he added society in order to complete the modified pedodontic triangle. That means McDonald in 2004. So that was the modified modified pedodontic triangle. Okay, so that was the basic of child psychology. It included a lot of terms from which you get various MCQs, and you will get for the theory part also you will get a lot of questions from here. I hope this was clear to you. There is no confusion. I hope you're following my teaching methodology. If there is any problem with my delivery of the lecture, please let me know. We shall have a healthy interaction. I shall improve if you want the methodology to be improved, and if you are liking it, please let me know that also. So that was about the basic of the child psychology. Now I am going to take you to a more serious, a more important, and a more understanding, a topic that will need a little more understanding, and that is the theories of child psychology. All right. So now we're going to read about the theories of child psychology. Clear? So when we read about the theories of child psychology, we can very safely divide it into, so the theories that are depending on stages, okay, okay, so these are depending on stages. Let me just make a box. All right. And then the theories that are according to learning patterns. So theories according to learning patterns. Is it clear? So the theories depending on stages, and then there is one theory, like for example, say here we can just give a sub, division, that is non-stage theories. Non-stage theory. Right. So now when we read about the theories depending on the stages, there are non-stage theories and stage theories. So in the stage theories, we have the psychoanalytical theory, the psychosocial theory, and the cognitive theory. So let me draw it for you in a better way so that you follow better, and if you want to copy it down. Yeah. So depending on the stages, we have the stage theories, and then there is a non-stage theory. Okay, so in the stage theories we have, there is a psychoanalytic theory, then there is a psychosocial theory, and then we have a cognitive theory. So these are all the stage dependent theories or the stage theories. And then there is just one non-stage theory, which is the social learning theory. Okay. Then according to the learning patterns, we have several. That is, there is theories of learning, classical conditioning theory, then we have operant conditioning theory, then we have hierarchy of needs, And then we have social learning theory. Yeah. So this beautiful tree is the classification of theories of child psychology. So if you've jotted it down, very good, or otherwise you can refer it back and jot it down. All right. So basically, the theories of child psychologies, this is the basic classification. Then again, it can be of three types. That is the psychodynamic theory, where we have the psychosocial theory, the psychosexual theory, or the psychoanalytic theory that was given by Sigmund Freud. Then there's a psychosocial theory, also known as the mode of personality development by Erik Erikson. And then there is a cognitive theory by Jean Piaget. Okay, and then we have theories of learning and development of behavior, where we have hierarchy of needs by Maslow, social learning theory by Bandura, classical conditioning theory by Pavlov, operant conditioning by Skinner, and then we have Margaret Mahler's theory of development. Quickly, I'm going to also write down this classification. This is also very important. I thought I'll skip the writing part of it, but this is important. All right, so when we read about the theories of child psychology, there is one more classification, which is the psychodynamic theory, which is the psychodynamic theories. Okay, then we have the theories of learning and behavior. Theories of learning and development of behavior. Okay, and then we have Margaret S. Mahler's theory of development. All right. So in the psychodynamic theory, we have Sigmund Freud's, Erik Erikson's, and Jean Piaget's theory. In the theories of learning and development of behavior, we have theories by Maslow, by Bandura, by Pavlov, and by Skinner. And then Margaret Mahler's is just the theory of development. All right, so hello, Mr. Sigmund Freud. We are going to begin with his theory, the founder of modern psychiatry, an Australian neurologist, finder of psychoanalysis, a clinical method for treating psychopathy. So he is Mr. Sigmund Freud. Okay. So Mr. Sigmund Freud, who is he? He is an Australian neurologist. He was an Australian neurologist. And what he gave us to read, a beautiful, beautiful theory, which is called as a psychoanalytical or a psychosexual theory. So it's a psychoanalytical or psychosexual theory that was given by Mr. Sigmund Freud. So according to Freud, what humans do, why they do it, what and how humans are largely determined during the first few years of life, during which a person develops characteristic ways of dealing with internal, that is sexual drives and conflicts, was basically told by him in this particular theory, which he gave in the year 1905. All right. Differences in personality originate from the differences in childhood sexual experiences. That is what he said in this theory, and that's why it is called as psychosexual theory, because he relates the development of psychology to the childhood sexual experiences. All right. Oh, you want me to increase my voice? Am I okay. So once it is audible, well, can you please again message me if this voice is okay? So should I teach you in this volume? I'll just come a little more forward. All right. Yeah. So the psychoanalytical theory basically that was given, please keep replying me if there is some such problem. I hope I'm audible now properly. The volume is all right now. Okay. So the psychoanalytical theory basically says that the human mind, about the human mind, Sigmund Freud gave two things, that is a psychic model or a psychic triad and a topographic model. So what did Sigmund Freud gave? He said that a human mind can be explained with the help of two models that he gave. One, a topographic model. Okay, thank you. So topographic model, and then there is a psychic. So in case my voice was really inaudible and you've missed on some topic, please message it to me. I will revisit the topic and explain it to you. So the topographic model and psychic model or psychic triad. Okay, so these two things he gave in order to best explain the human mind. Now let us first look into what exactly is a topographic model. So in order to explain the topographic model, he took the help of an iceberg. Okay, he did not bring an iceberg or anything, he just explained it through a diagram of an iceberg. All right, just a minute. Okay, yeah. So an iceberg, for example, this is the water body. So this is the water body. Okay, and you all know what is an iceberg. You've all seen Titanic. So the reason they made Titanic was an iceberg. So iceberg is nothing but a huge mountain of ice that is present in water, submerged in water. And the thing about iceberg is that only some part of it is present above the water. The most of the part is present submerged inside the water. So this is how an iceberg is. Most of the part is submerged inside of the water, and a small part of that huge ice mountain is present above the water. So what he said is an iceberg can be divided into three parts. How can it be? So there is this part that is visible outside. There is this part that is present in the superficial waters, and then there is a part of the iceberg. Yeah. Okay. And then there is a part of the iceberg which is submerged inside the water, which is deep down. Probably no human form can reach there, or without assistance at least. So you can safely divide the iceberg into three levels, that is. Okay, so how did Mr. Sigmund Freud compare the iceberg with human mind? What he said is, just like an iceberg, we can divide the levels of the human mind into three levels. The first level, which is visible, or which you can feel, which is visible to you, to the others around you, is the conscious mind. Okay, the second level of the mind is the pre-conscious mind. Okay, and the deepest level of the mind is the unconscious mind. Okay, so this is how you can relate an iceberg to a human mind. So now what is present in the conscious mind? Since it is visible outside, that means he said that the conscious mind contains the thoughts and the perceptions. Like for example, you are listening to my lecture, probably you have pictured an iceberg in your mind. Okay, some of you might have strayed away, some of you might be thinking about the movie Titanic, the hero and the heroine. So that's a current thought or the perception. So what is going on in your mind right now is your conscious mind, is the thoughts and the perceptions. Okay, so let me write it down over here. So conscious mind contains the thoughts and perceptions. Right? Then there is a pre-conscious mind which contains the memories and stored knowledge. Okay, so the pre-conscious mind contains the memories and stored knowledge. Yeah, like you have various childhood memories, like when you were in second standard, you had hit a friend, or probably you were best friends with somebody but you guys fought. So you have a memory of that. There are a lot of beautiful memories, there are a lot of bad memories which you can visit when you want. So those memories are not in your present thoughts. Okay. But you can revisit those memories whenever you want. So they are present in your pre-conscious mind. And the stored knowledge, okay, like you would have read about capitals, like the capital of Gujarat is Gandhinagar. So you're not thinking about it right now, but if I ask you what is the capital of Gujarat, you are going to revisit your stored knowledge, and then you're going to come out with the answer. So all of that stored knowledge, the old memories, everything is present in the pre-conscious mind, which can be revisited whenever you want. You can go into the water, dive, and then bring out your stored knowledge and memories, and then they are right there, so you can revisit them. Whereas in the unconscious mind, the one that is deep down in the unconscious mind, there are the fears, the violent motives, okay, the selfish needs, the irrational wishes. Okay, so these things are the things that are present inside your mind, but you do not forget revisiting again and again. You do not visit them at all. These are the violent motives and the the irrational wishes. For example, you have had an ex, and you guys had a very bad fight when you broke up, and very deep inside you want to kill that person, you want to hit that person very very badly. So but you can't do it. It's in the sane mind, you can't do it, but it's there. There are so many irrational wishes and so many violent motives that you have, but you don't think of it, you don't think of applying it, because you are sane, because you are psychologically fit. So all these things are wrapped up and thrown deep down into the abyss, into the unconscious state of your mind. So now the people whom you call as psychopaths, or people who do not have the balance of their mind, the criminals, the killers, the serial killers and such psychopaths, they lose control of their unconscious mind, and their violent motives and irrational wishes all surface up. So it's a kind of a mental imbalance that occurs. So you do not generally revisit or visit or think of your unconscious, or what is thrown deep down into your mind. So that's the unconscious level of your mind. So I hope you now know what is the conscious level, what is the pre-conscious level, and what is the conscious level of your and the unconscious level of your mind. So this is called as the topographic model, or the iceberg phenomena. So that is what Sigmund Freud explained in the iceberg phenomena, or the topographic model. All right. So now, so that was about the topographic model. I hope it is clear to you. Then he came to the psychic model, or the psychic triad. Okay, so in the psychic triad, he gave 3 terms, which were ID, ego, and superego. ID, ego, and superego. Okay, so what basically do these terms mean? So let me just tell you, all of these three phenomenons, the ID, ego, and superego, coexist in your mind. Now that you're a grown up person, all these three things coexist in your mind. All right. So it is the ID is the most primitive impulse which is present at birth. So now let us jot down what are the features of all these three. So beginning with the ID. ID is present at birth. Matlab, this phenomena of a mental thinking is present at birth. It is governed by the pleasure principle. So do not worry about these terms. I'm going to very well explain it to you through examples. So it is governed by pleasure principle. Right. It satisfied the fundamental urges immediately without regards to rules, realities, or life morals. Okay. So, like, this is present at birth, and ID is governed by pleasure principle. Like, for example, just think of a small child, a very, very small child, say 3-month old, 4-month old. He is hungry. All he knows is, I am hungry, I want to eat. I want not eat exactly, but I want something to fill my tummy. So all he's thinking about is satisfying his or her hunger. Is it clear? So he will cry, he will get what is fed to him, and then he will be satisfied. He has nothing to do with rules, realities, where the person is, why the person, for example, you're traveling, the child is traveling with the mother, or for example, the mother is just walking around somewhere. He is hungry, he is going to cry. He has nothing to do with the situation, nothing to do with the realities or rules. So that is called as pleasure principle. He demands for pleasure, he demands for satisfaction, he has to get it immediately. It is impulse driven. Again, it is called as, it is an impulse driven phenomena. Okay, what is impulse? Impulse is something that is done or being wanted without giving a second thought. That's impulse. Okay, so it is impulse driven, strives for immediate pleasure and gratification, and it lacks the capacity to delay or modify the instinctual drives with which the infant is born. It does not want to delay or modify, like, you cannot tell a 3-month old ki, my dear, please stop crying, I am going to give you food after 1 hour when we reach home. He's going to cry even louder. Okay, so you can't do that. You cannot give logic, you cannot make him understand. Alright, so that's ID. Next, okay, so in ID we will also read that there are two ways in which the ID tries to achieve reduction of tension. Okay, now this ID phenomena, it is impulse driven and it wants pleasure. Or it wants satisfaction. So how does it try to achieve the reduction of tension? Like, for example, a child is crying. For example, the mother has gone to the washroom. Now the child is crying, he is hungry, the mother is taking a couple of minutes to come out and everything. So he uses certain reflex actions to achieve reduction of that tension. He is very tensed, he is very aggressive, that where is my food, I want food. So he has certain reflex actions to reduce that tension. What is it? It is a simple, so these reflex actions are nothing but simple response that occurs reflexively to the stimulus, for example, hunger in the environment. For example, the child sucking on a nipple, which reduces tension and quietens the aroused and unhappy child. Like like the child is crying, and you think that the mother is going to take a couple of minutes more to come out, so you give a pacifier, for example. You just put a pacifier. You know what is a pacifier, right? That small little nipple that the child can, do the sucking on. No nutritive thing in it. So what you do, you give a pacifier to the child so that he stops yelling. Okay, so the child starts sucking on the pacifier. So that's a type of reflex action that he is using to reduce the tension. Or if the child has started sucking the thumb, he will start sucking the thumb. Or very small children, they'll start doing the sucking action in the air only. like that, I cannot do it, it'll look very funny. But the child will start doing it in the air without anything in the mouth. They'll start making that sucking action through the lips. So these are all the reflex actions to reduce the tension if it is taking a little too long. So it is a creation of fantasy about the object, like a child doing it in the air without anything in the mouth. He's just fantasizing that particular object or behavior to reduce the tension and satisfy the ID's drive. So this person's drive, or this phenomenon's drive, needs to be satisfied. Okay, so the child starts imagining like that. So that is about the id is present at birth. It is driven by impulse, and it is based on pleasure principle. It wants anything right now. Okay, the second the second phenomena of the psychic triad is ego. Okay, so it is ego. So ego is nothing but the thought process. Okay, so let's just keep its nickname as thought process. All right, so ego develops after birth. Okay, it expands with age and it manages the ID. Okay, so this is present, it develops with time, or expands with age. Okay, and it manages ID. Like, for example, now the child was 3 months old, so he wanted, when he was hungry, he wanted the food right now. But the child is now, say, 2-year-old, and the ego has expanded. So the child is hungry. He will start crying or probably demanding for food. Mama, I want to eat something. Okay, I am hungry. But the ego will manage, like, if the mother says, okay, fine, just give me 10 minutes, I am going to cook something for you and then you can have it. So that ego is going to relax the child, or he is going to manage the child, that you are going to get it, but you will have to wait for 10 minutes. So the child is going to sit for 10 minutes. Okay, so what has the ego done? The ego has managed the ID part. Is it clear? So the child demanding food immediately is the ID working, but the child is waiting for 10 minutes until the mother gets him a dosa or gets him a paratha. So that is ego part managing the ID part. So now the ID is also there in his mind, the ego is also there in his mind, but the ego manages the ID. I hope it is clear to you. Okay, so it expands with age, it manages the ID, and it works on reality principle. Ego works on reality principle. Am I clear? Yeah. So ego works on reality. Just how ID was working on pleasure principle, it works on reality principle. Ego has a little brain, okay, that there is something called as practicality, there is something called as reality. You have to sometimes wait for some time. You do not get what you want immediately. Okay, so the tension between ID and reality helps the ego develop more sophisticated thinking skills. It is concerned with judgment and memory. So ego is something that helps in developing judgment and memory. Alright, so is it clear to you, ID and ego? And then comes the superego. So as the child grows even more, the child develops this aspect called as the superego, and let us keep its nickname as social rules. Okay, so we quoted that ego is probably in children. When the child was 2 years old, he waited for 10 minutes to have food, but he is not very much affected with the social rules. Like, for example, if there is a mother and a child who has come in a marriage function and the buffet is still not there and the child is hungry, so the ID is going to speak that I am hungry right now. The mother says that, all right, wait for 10 minutes, I'll get you food. So the ego will ask the ID to sit quietly for 10 minutes. The mama is going to get food. Okay, but after 10 minutes, the ego will be like, where is food? I am hungry. Okay, but if he is a little more older and super ego sets in, he will understand that we've come to a marriage function and mama can really not do a lot. We'll have to wait for the buffet to be out there and only then she can get us food. I should not throw temper tantrums, I should not yell or cry because that is going to embarrass mama in front of everybody. So that is social rules setting in. So that is super ego. So super ego is also called as conscience. All right, it develops around 5 years of age, and again it starts expanding with age. All right, consists of prohibitions learned from parents and society. So this is based on prohibitions learned from parents or society. Okay, it may criticize certain things as wrong which the ego would otherwise do to satisfy the ID. Okay, so let me give you an example over here. I think I have a picture for you. All right, so this is the picture. So you have all these three components in your brain. You have an ID, you have an ego, and you have a superego. All right, so the ID is going to say, I want it now. The ego will tell the ID, I need to do a bit of planning to get it. You just cannot randomly have it. Whereas the superego will say, you can't have it, it's not right. So a better example that I can give you is, okay, I still have one more. Okay. So the ID might say, I want a chocolate. Okay, the ego will say, eat just a small bar of chocolate, not much, because ego wants to compromise. He wants to work together with super ego and ID. Ego knows that probably eating a chocolate is not a right decision, but he wants to satisfy the ID also. So he'll say that, okay, eat a very small bar of chocolate, all right. But the super ego will say, don't eat it at all, you're on a diet. Okay, so super ego is governed by rules, it is governed by principles, it is governed by discipline, whereas ID is not governed by at all, governed by anything at all. It is impulse driven. And the ego plays in order to make compromise in between super ego and ID. Okay, it is an in between thing, and you might get an MCQ asking which component of the psychic triad is predominant in our brains or in human mind. So the answer is clearly ego. Okay, so I quote this example very commonly. You are sitting in a class and you feel hungry. The ID will say that there is chips ka packet kept inside the bag, just pull it out and eat it. So that is the ID saying that. But the ego will say ki, okay, you want to eat it, just wait for the teacher to turn around and then slowly I'll pull it out and eat it slowly. But the superego will say, no, it's not correct. It is indisciplined to eat in the class. So that is what superego is going to say. So I hope the ID, ego, and superego is clear to you. All three of them are coexisting in your mind. Ego is predominant. It tries to act as a mediator between superego and ID. Clear? Okay. So that was about the psychic triad, which consists of ID, ego, and superego. Okay, so the psychic triad is clear to you, and I hope the topographic model or the iceberg phenomena is also clear to you. All right. So now that I told you that the ego is predominantly functioning in the human mind, out of ID, superego, and ego is predominantly functioning in the human mind, right? So there are certain mechanisms which are called as ego defense mechanisms, which are present in the attitude or behavior of a person. Okay. Ego defense mechanisms. So ego is something that is acting in between. It is trying to be good with superego also and id also. So sometimes ego deals with the demands of reality, that is the id, and superego as best as it can. When anxiety becomes overwhelming, the ego should defend it. Does by unconsciously blocking the impulses or distorting them into more acceptable and less threatening form. So this is all blah blah blah. I am going to explain what are defense mechanisms, and with examples. It's going to be real fun. Okay, you will be relating with all of them, so listen very very carefully. So the various defense mechanisms, the ego defense mechanisms are these. So just listen to the terms, and one by one with example I am going to tell you what do these terms mean. So the defense mechanisms are these. So the first is displacement. There is projection. There is reaction formation. Please don't be scared of the terminology. It is super to read what these mean, and it is super relatable also. Regression, repression, rationalization, denial, and identification. Okay, so now ego is the working part of the mind, and sometimes there is a situation that the ego cannot handle, or there is an overwhelming situation. So ego takes up one of these ways to handle an overwhelming situation. So what do these particular ways mean? I have pictures for you for that. Okay, so what is displacement? Displacement is basically transfer of desires or impulses onto a substitute person or object. So transfer of impulses onto a substitute. Say whether it is a person or a what do you call as an object. Like for example, boss shouts at Jane, and then Jane needs to deal with it. Okay, Jane is very overwhelmed that the boss shouted at me, and she couldn't shout back at the boss. Obviously she couldn't do that, so she needs to, the ego is hurt, the ego is overwhelmed. So what will it do? It'll go and get angry with the husband. So what Jane has done, Jane has displaced the negative feelings. So when negative feelings are displaced onto the another, they become less threatening subject with the slightest trigger. So she is going to go and yell at the husband or fight with the husband, and she'll feel okay. So what she's done, she's displaced the overwhelming situation. So the ego was overwhelmed. It did not know what to do because the ego obviously couldn't shout back at the boss. So the ego displaced the inside torment to the husband. So it displaced it to a substitute person or an object. That's displacement. Okay. The second phenomena is projection. So what is projection? It is characteristic or desires that are unacceptable to a person's ego are externalized or projected onto someone else. For example, a person having aggressive feelings towards others may find it unacceptable to admit that he or she has such feelings. They may be projected onto others such that he or she may now feel that others have aggressive feelings towards them. Okay, so I'll tell you the example. Like, okay, yeah, this is a very funny example. The first thing is if you want, if there is an unaccepted feeling, like you have done something wrong and you will right away say it's not my fault. You will make yourself understand that it is not your fault. You don't have to accept what you are feeling. The guilt that you are feeling, you don't need to accept it. It is her fault or his fault, or it's just not my fault. So here is a very funny example. So for example, a girl and a boy are in love with each other. So the boy does not want to admit that he is in love with that particular girl. So instead, and he does not want it to admit himself also. He's feeling that soft corner for that girl, but he does not want to admit that he's feeling something for that girl. So he'll deliberately go and shout at that girl, or he'll deliberately go and be rude with that girl, so that the girl also gets pissed off. The girl doesn't roam around him. Plus he tells himself that, see, I do not feel anything for this particular girl. So reaction formation is someone who is unconsciously attracted to another person, may keep the impulse out of the mind by being mean to that person. So that is reaction formation, or projecting it in a very different manner, or projecting it in a crooked way. All right. Then the next is regression. Okay. So the next is regression. So in regression, we have individual attempts to avoid current anxiety by withdrawing to the behavior patterns of an early age. Okay. So here is repression and suppression in this picture. So I'm first going to tell you what is regression, then we'll come to this picture. So regression, as in a child with a history of nail biting may resort to the same after growing up as well in times of danger. Like if a child had the habit of biting the nails when he was scared, even when he grows up, he might start biting the nails when he's scared or anxious. So that's called regression. That means you go back to your early age behavior in order to avoid some sort of a current anxiety. That is regression. Okay. So you might have also heard examples like there are adults who, when they are anxious or when they are very hurt or this thing, they still hold a soft toy and sleep, because that's what used to comfort them when they were children. So they regress to their early age habits in order to feel or in order to reduce their anxiety. That's called as regression. Okay. Then we come to repression. So repression is expulsion of thoughts and memories that might provoke anxiety from the conscious mind. So there are two things, that is repression or suppression. So repression means unconsciously denying the impulses. That means the person is angry, but he puts on a cheerful front. That means he is repressing the feeling, repressing the anger. Whereas there is suppression, that means the person is angry, but he counts till 10 in order to consciously suppress the impulses. That is suppression. So there is repression, where he is just smiling. He does not want to think about why he is angry. But suppression is he is trying to suppress or calm down. That is suppression. So there's a dental example that I would want to quote here. If a child has a painful dental experience in the past, in the future, when he visits the dentist, he may avoid thinking of that painful event in order to repress the anxiousness. Is it clear? So that is repression. I hope you are following what I am telling you. Then the next ego defense mechanism is rationalization. This is pictures of rationalization. So what is rationalization? Attempt to explain our behavior to ourselves and others in a way that are seen as rational and socially acceptable. To find logic in one's action. Like for example, if a particular child has failed in his exam, he'd say that I failed because my teacher hates me. Okay, so he's trying to explain the situation to the people in a socially acceptable manner. Okay, he's not accepting his own mistake, but again, he is explaining it he's rationalizing, he's putting up a logic behind it. I failed because the teacher hates me. Okay, I did my best, but the teacher hates me, that's why I failed. So there's a very famous story about this fox who can't have the grapes. So he complains that the grapes are anyway sour. What will I do even if I have the grape? So let's not have the grapes at all. So basically, this is rationalization, applying logic to somebody's failure. That is rationalization. Clear? Then the next ego defense mechanism is denial. So a person may deny some aspect of reality. The patient, for example, a patient with a big ulcer in the mouth diagnosed as carcinoma may not be able to tackle the situation, and he may keep consulting different doctors with a hope that somebody is going to say, no, it's not cancer, it's just a normal ulcer and you can take multivitamins and it will be gone. So the person is not ready to accept the situation, accept a traumatic or an overwhelming situation. So he looks for options where he can just say no, or he can just deny the particular situation. Okay, so if somebody is facing some sort of a situation, he just says that it is ridiculous, the story is 100% false, there is no logic in this story. He's just denying the actual this thing. Then the next ego defense mechanism is identification. So identification is basically incorporating an external object into one's own personality, making them a part of oneself. Like for example, a child trying to, he feels that he's a Spider-Man and he can jump from here and there, he can run around and something. So identification means identifying oneself as somebody else. You feel that you're a part of that person, and that is identification. All right, so that completes all our various what do you call as the different ego defense mechanisms. I hope each of them is clear to you. So there were these many ego defense mechanisms. There was displacement, there was projection, reaction formation, regression, then repression, rationalization, denial, and identification. These were all of these different ego defense mechanisms. I hope these are all clear to you. So far about Sigmund Freud. We read that he gave a topographic model. He gave a psychic triad. And he did not stop there. He also gave the psychosexual stages. So he gave various psychosexual stages. So what were those stages? Basically, there are 6 stages to read about. So the first stage is oral stage. The second stage is anal stage. Then we have the urethral stage. Then there is the phallic stage. Then there is a latency stage. Then we have the 6th stage, which is the genital stage. This is latency. Clear, hai na? Genital stage. So these 6 stages, known as the psychosexual stages, were given by Sigmund Freud. So we are going to one by one read about these stages. So let us begin with the first stage, which is the oral stage. So oral stage is basically in children of age group of 0 to 1.5 years. So the age is 0 to 1.5 years of age. Okay, the erogenous zone is the mouth. Mouth is the erogenous zone. All right, the gratifying activity. So erogenous zone needs satisfaction, and the gratifying activities are by nursing, eating, swallowing, sucking, and biting. So these things will gratify, or these things will satisfy the erogenous zone. The interaction with the environment. So the mother's breast not only is the source of food but is also a source of security and her love. The child personality is controlled by ID in this particular stage, and it demands immediate gratification, and it demands responsive nurturing. Responsive nurturing, as that means that when he wants to feed, when he is hungry, not only when he is hungry, when he is feeling insecure, for example, he's got hurt, he's fallen down, the child, he needs a source of security, so he will expect the mother to nurse him, and that is called as responsive nursing. So responsive nursing will comfort him. All right. So according to Sigmund Freud, these particular things, if the child does not get when he wants during this particular age, there is certain phenomena that is called as oral fixation that occurs. Okay, so as I earlier told you, according to Sigmund Freud, certain things need to be achieved in certain stages in the life of a child. If the child is unable to achieve those things or those secure points during that particular stage, he becomes insecure, or there is something wrong with the psychology of the child, and that means the child is fixed to that stage. That is called as fixation of that stage. Okay, so if the child is not met with gratification of the erogenous zone or responsive nursing during the oral stage, what occurs is called as oral fixation, and the symptoms of oral fixation are smoking, nail biting, drinking, and sarcasm. So everything that uses the mouth. Okay, so whenever an individual is fixed at the oral stage, he develops these particular things, which again makes him feel secure. So smoking, nail biting, drinking, sarcasm, these things are done when a particular person is overwhelmed, when he is feeling insecure in himself, so he'll resort to such activities to feel comforted or secured. Okay, the desire of ID is changed because of age. However, some individuals never lose that even after ages, and might produce some pleasure producing stimuli like smoking, drinking, etc., or he or she do the same even after the ages. So a child should feel secure at every developing stage. So oral fixation, let's say, resorts to smoking. So it's not common with everybody. Now don't go and look at every smoker like a person who has not been gratified during the oral stage. It is just one of the things that develops if a person is not being gratified. Okay, because these are the things these are various pleasure producing stimuli. A person can resort to these things to feel a little more secure in order to counter an overwhelming situation. Is it clear? So oral fixation, these things might develop. The next stage is anal stage. So in the anal stage, the age of the children in this stage is 1.5 to 3 years. The focus, the zone in focus, the erogenous zone in focus is the anus. The gratifying activities or the satisfaction of the erogenous zone is done by the bowel movements and withholding of such movements. So before before this particular age, the control of these sphincters, the anal sphincters, was not obtained by the child. There was no control of the anal sphincters, so the child used to defecate or urinate without being able to control when he should do it. So the child wears diapers, or probably the mother changes this thing and all. But during this anal stage, when the child is around 1.5 to 3 years, he develops the neuromuscular control of the various sphincters. So now he can control his bowel movements, and he can withhold the bowel movements and defecate at will. So defecation at will gives him the pleasure, the gratification of the erogenous zone, and this is the time when the parents resort to toilet training the child. That means they teach the children when they should convey that they have to go to defecate or urinate. Pleasure and displeasure is associated with the bowel movements. Okay, so this is what a child develops. Okay, so he develops the control of these sphincters. Now what are the symptoms of anal fixation? Now, because of some ailment or because of improper training by the parents or something, if the child gets fixed in the anal stage, or if there is anal fixation, then what happens? The patient becomes too lenient. The child derives pleasure and success from expulsion. The fixation, so this occurs when there is a proper anal phase, but if it is fixed, then the child becomes excessively sloppy, disorganized, reckless, careless, and defiant. So the child who is fixed in the anal stage will be excessively sloppy. I mean, he will not be very self-confident, let's say like that, or self-sure, or very, very, positive about himself. He will be disorganized, reckless, careless, and defiant. Okay, the child receives the child with such fixation will be clean, orderly, and intolerant to those who are not clean. Okay, so this is again one of the symptoms of anal fixation. The next stage is urethral stage. Okay, so the age of the patient in this stage is 3 to 4 years. The erogenous zone is the transitional zone between the anal and the phallic stage, and urethral stage has the characteristics of both the anal stage and the phallic stage, because it lies in between. So the gratifying activities are the pleasure derived from urination and interaction with the environment. So urethral erotism, that is pleasure in urination as well as urethral retention. The child derives satisfaction from the pleasure in urination, right? That is controlled urination. Okay, so the next stage is phallic stage. So we are jumping to phallic stage so soon because urethral stage is nothing but a clubbing of the anal stage and the phallic stage. So what happens in the phallic stage? In the phallic stage, the age of the child undergoing this particular stage is 4 to 5 years of age. The erogenous zone in this particular stage is the genitals of that particular child. The key event that occurs in this particular stage is feeling of attraction towards parent of opposite sex together with fear of same sex parents. So here in the phallic stage we are going to read about two concepts, that is Oedipus complex. So Oedipus, the spelling. Oedipus complex, and there is an Electra complex. So Oedipus complex is present in the boys, and Electra, as the name suggests, is the name of a girl, so it occurs in the girls. So here in the phallic stage, according to Sigmund Freud, what happens is in the Oedipus complex, he says that the young boys of this age group are sexually attracted towards their mother, and they have a feeling of fear or a feeling of competition towards their fathers, that is the same sex parents. And similarly, the girl child is attracted to their father with a feeling of competition or fear from the same sex parent, that is the mother. So this is the Oedipus complex and the Electra complex that was explained by Sigmund Freud. And you will get MCQs asking which stage in the psychosexual stages of Sigmund Freud demonstrates the Oedipus complex or the Electra complex. So that's undoubtedly the phallic stage. So you're going to mark that as the correct answer. Correct. So for men, if there is fixation of the phallic stage, there is anxiety and guilt feelings about sex, the fear of castration and narcissistic personality. And for women, women never progress past this stage fully, basically. So we'll always maintain a sense of envy, inferiority, but there are no possible fixations like that. But there is going to be, a sense of insecurity, a sense of body negativity in case of women who are fixed in this stage. So this is the phallic stage. The next stage is the latency stage. Okay, so in the latency stage, we have children who are 5 years to puberty, 5 years of age to puberty. Okay, there is no erogenous zone in the latency stage. The sexual feelings are suppressed to allow children to focus on their energy and on other aspects of life. The time of adjusting to this is the time when they adjust to the social environment, absorb culture, form beliefs and values, developing same sex friendships, engaging in sports, etc. The child energies are more channeled in this stage into developing new skills, like they can learn new dances, swimming, new sports, etc., and acquiring more and more new knowledge. So that is the latency stage. And the last stage is the genital stage. So we have the genital stage here, which is the last stage of the psychosexual stages. So in the genital stage, we have the children who are puberty and onwards. Okay, the erogenous zone is again the genitals. Alright, the gratifying activities now are the heterosexual relationships. So in the latency stage, they learn to make same-sex friendships, like the girls will be friends with girls and the boys will be friends with girls. But in the genital stage, now they are all teenagers and above, so they will start making heterosexual relationships. The interactions with the environment will be like renewed sexual interest and desire to pursuit of relationships. So there are 3 major sources of sexual arousal in the genital stage: the memories and sensations from earlier childhood, the physical manipulation of genitals and the erogenous zones that the children put up to, and then the hormonal secretions that will there will be certain hormonal secretions which will back these feelings up. So if the child is fixed to this particular stage, if there is genital fixation, it generally derives no symptoms. People experience difficulty at this stage. The damage, if the people are experiencing difficulty in this stage, that means there has been some damage done in the oral, anal or phallic stages. There is no basic symptoms of genital fixation. All the ill experiences that occurs here are due to the fixation of the earlier stages. So this was about the 6 psychosexual stages that were explained by Sigmund Freud, and that was a heavy 2-hour lecture, I think. I hope you followed until now what I taught. It would be great if you keep giving me a bit of a review. So right now I'm gonna give you a 7 to 10 minute of a break. So just go refresh, and then we're going to continue with a few more theories there. That will follow the Sigmund Freud's theory. So let us meet after a 10-minute break. All right.